There's no longer white-collar jobs. They are nowhere to be found. The population is increasing on a daily basis, and the government cannot provide all the needed jobs for the bulging youths.
It's the doctor that the patient has to get a prescription for. The reason is that when the patient comes, the patient gets a card and is directed to see the physician.
Not that I mean to undermine polytechnics, they do a good job, but university education is actually more valuable.
Hello viewers, welcome to this week's edition of Crossfire, reaching you from the Anglican Cable Network Nigeria, ACNNTV. I am Blessing Ugochukwu. Crossfire is a program that treats controversial topics on diverse issues surrounding the society. Our focus this week is on the medical sector, and our topic is who should a sick person consult for medical prescription, a doctor or a pharmacist? Joining me in the studio to discuss this topic are Dr. Ejike Oji. He is the chairman and technical director of Association for the Advancement of Family Planning, AAFP, CSO Focal Point, FP 2020 for Nigeria. He will be speaking from the perspective of a medical doctor, while Ms. Olubukola Tikare, who is a pharmacist currently working at the Federal Medical Center, Jabi, she will be speaking from the perspective of a pharmacist. You're welcome to the program. You're welcome, sir. You're welcome, ma.
Thank you.
You're looking so wonderful.
Thank you.
So, doctor, I would like to start with you. What is your view concerning this topic?
Yes, when you come to the issues of medicine, I always say it's a teamwork, and the focus is on the patient. When a patient comes to a hospital, and then, because I saw the question is where does the patient get a prescription from?
Yes.
So it's the doctor that the patient has to get a prescription for. The reason is that when the patient comes, the patient gets a card and is directed to see the physician. It is only and only when the physician has seen the patient and decided what is to be done for the patient that the patient either is directed to go to further medical examinations to confirm the diagnosis, or procedures or whatever. And then, of course, when the doctor is sure of what is wrong with the patient, then the doctor makes a prescription and directs the person to go to the pharmacy for this prescription to be filled. So the simple answer is the doctor that makes the prescription in the hospital.
Okay, thank you very much, sir. Okay, coming to you, what is your view concerning this topic, ma?
Well, like he said, we actually work as a team for the benefit of the patient. We want the patients to get healthy. That's the most important thing. But I'd like to look at it from a slightly different perspective. For instance, in Nigeria that we are in, we see patients that are ill, maybe they have a headache or they feel feverish. They go to the nearest point, usually a pharmacy. So they will come and complain to you, okay, I have headache, I have fever, or my child is sick. So the first question is, you want something to at least relieve that symptom before you can now say, okay, go to the hospital for further treatment. So usually you might not write a prescription, but you can recommend something to just take care of it there and then before you now refer. Of course, you ask questions, try to know, okay, is this something that can be helped here? Maybe is it just a runny tummy, or is it just a headache? Is there a need for further investigations? In that case, you can now send them off to the hospital.
Okay, thank you very much, ma. So, doctor, I want to know, is it possible, can a doctor, as a medical doctor, can you cancel any prescription prescribed by maybe a pharmacist or other health professional?
Well, when you say cancel, it looks belligerent. If you see a prescription from a patient and then you've examined the patient and then you see that the patient has been given a prescription, first of all, that will probably not take care of the problem the patient has, or that you have also spoken to the patient, examined that is interview the patient or clerk the patient, as we say in medicine, and examine the patient. And then you see that the prescription given to the patient will harm the patient. Then you can tell the patient that remember that everything depends on the patient's rights. But you can advise the patient that this prescription is not good for you. Let me give you a simple example. If you, within the time of clocking your patients, and you get a family history, not the family history, in fact, a personal past medical history of ulcer, and then you see in the prescription, you have 2 non-steroidal analgesic drugs like diclofenac or Feldin in the prescription. These 2 drugs can make a patient who has ulcer bleed to death in some cases, or cause what we call severe gastritis. So once you see that kind of thing, it is important that you say this prescription won't stand. So in such cases, but it's also good that if it's a fellow doctor that prescribes, you need to contact the doctor and know why he or she made that prescription. And then any prescription that comes should come signed by the name of the doctor. So like I said, legally, I heard what my sister said about advising, because I chose the word very correctly. The only person legally allowed to make a prescription in a hospital is a doctor. We do a lot of things in the country because our healthcare system is not so well developed. And then, but if it's tested in law, if anybody makes a prescription and it's not a doctor, even if you're a doctor and you have not paid your licensing fee for that year, you are regarded as a quack. If anything happens to that patient, you can go to jail, even if you're a doctor. So it's always good to make that very clear. But however, having looked at the circumstances of our situation in Nigeria, some of us also have started pushing. Yes, pharmacists are not supposed to prescribe, nurses are not supposed to prescribe, but because of the exigency of the situation we have on our ground, we have developed and pushing to develop a comprehensive task shifting policy in the country. So that will be structured, and then I'm part of developing that task shifting policy. In fact, we just had a meeting 3 weeks ago where we worked with the Pharmacy Council of Nigeria. We're developing task shifting policy for PPMVs, that is the lower cadre of people who give out medications across the counter, what we call the OTCs, over-the-counter drugs. You know, we also want to make sure that there is some level of regulation at that level. Because anytime I go home and I go to a pharmacy, not a pharmacy, a patent medicine store, and there are 3 types of patent medicine store providers. One, somebody who has no clue, he's just a trader, and then he knows that he can make money buying and selling drugs. The second tier is a nurse or a healthcare worker who have had some level of training in a hospital environment, like a nurse or a CHU or a senior CHU. Then the third one is a pharmacy assistant. The pharmacist assistants assist the pharmacist in the hospital. So there are those 3 tiers. And what we're saying is that we should give them some level of training so that they can recognize simple things and take care of them. But most importantly, we also should train them to make sure there are certain things they don't dabble into, and they must refer to a physician or to a hospital to take care of it.
Okay,
Yeah.
Thank you very much, sir, for that. Okay, ma, according to the doctor, is allowed to cancel prescription, like he can call another doctor. You are a pharmacist and you are into drugs. That is your field. Do you support that idea? Like, can you cancel a prescription prescribed by a doctor, probably knowing that maybe it has side effects on that patient?
Okay, well, I wouldn't really use the word cancel. That's a bit extreme. Like, I work in hospital, for instance, and I would, after the patient has seen the doctor, the prescription will come to the pharmacy. So definitely, if I see a long list of drugs, I would ask, calling the patient, have a word. Okay, what's going on here? What was your complaints? If I have any issue with any of the drugs on that prescription, maybe not because it's wrong, maybe, as he said, past medical history, or maybe there are some drug interactions, or it could even be as simple as, pharmacists, these drugs where they write for me plenty, I'm not sure say I go drink them. You know, even things as minute as that, I would go have a word with the doctor. Like you said, we work as a team. So I would speak to him, okay, this patient has told me this. Because sometimes the patient might tell the pharmacist some things and might not tell the doctor. Might tell the doctor some things and not tell the pharmacist. That's why we're working as a team.
As a team.
You understand? So I'll go speak to the doctor. Okay, this is this, this is this. Then we can now look at it from, looking at it from both our knowledge base. What is the best for this patient? Of course, there are sometimes that there's a little friction sometimes. In that case, we look for maybe a tiebreaker, maybe a more senior doctor or a more senior pharmacist. But the most important thing is that you want the patient to be healthy. So we'll put all those differences aside most of the time.
Okay, from what you just said, you said we shouldn't use the word cancel. Okay, let's look at it from this perspective. Okay, is there any possibility that a patient come with a prescription prescribed by a doctor and not really cancel? Is there any possibility of you as a pharmacist changing that prescribed drugs to maybe drugs that also works in that particular sickness, where maybe probably that particular drug is too expensive or something, like give something else? Is it possible for you to change, not really cancel?
Okay, usually it's expected that doctors will prescribe in generics, so they will not write any particular brand. So in that case, I as a pharmacist will give what I have in stock, so irrespective of brand, because it's expected that they all work the same way. There's no better one than the other. But if I'm going to change, for instance, he said, oh, what example can I use? Okay, maybe they wrote paracetamol.
Okay.
And maybe after speaking to the patient, the pain is more than paracetamol. And I want to say, okay, maybe this patient doesn't have ulcer. We want to do diclofenac. I will not on my own just change it. I'll go back and have a word with the doctor. And we'll both sit down and look at it. Because another thing that you have to know is that when patients come and see the doctor, everything that is done is documented. Okay. So the doctor that wrote the prescription has documented a copy of it in the patient's folder. So it's totally wrong for me, without consulting the doctor, to just on my own change it. Because if anything goes wrong, actually, I will be held liable. It's not within my scope of work to change, except if it's just maybe a brand thing or something like that. Yeah.
Okay. Thank you very much, Ma, for your contribution. Thank you, sir, for your contribution so far. It has really been wonderful sharing your ideas with us. We shall be going on a short commercial break. We shall be back. Don't go anywhere. You're welcome back to Crossfire. For sponsorship, advert placements, and to be an ACNNTV Kingdom Investment Partners (AKIP), please call the displayed numbers on your screen. To view more of our exciting programs, please visit our website at ACNNTV.com. And in case you are just joining us, we are still discussing a topic: who should a sick person consult, the doctor or the pharmacist? And we are in the studio with Dr. Ejike Oji and Miss Bukola Tikare. So let me continue with you, Doctor. Just to enlighten the viewers more, I want you to state the primary duties of a doctor. As a medical doctor, what are your primary duties?
Well, usually there's a way I define being a medical doctor. The primary purpose of a medical doctor is to remove pain. And when I say remove pain, it's either physical, psychological, or psychosomatic. Just remove pain. And that is the objective of a medical doctor, the final objective. So in be able to pursue that, the doctor has to be able to see a patient, and then if you see a patient, take a history of the presenting complaint. And then within that ambit of taking a history, you need to go into the previous medical history and surgical history of the patient. And if it's a woman, also go through the gynecological history. This is to get an insight of the past of what has been happening to the patient. And then you need also to dig into the issues of hereditary, because there are some diseases that are hereditary. Things like diabetes, even cancer of the breast. If your mother had cancer of the breast, there are about 17% or 25% that you might have cancer of the breast also. So you dig into those previous medical history. And after that, then you examine the patient top to toe, what we call top to toe, from head to the toe. So in doing that, what are you trying to do? You're using the history of the patient, the complaints, and then also you are now doing a physical examination to be able to make a diagnosis. Once you come to a diagnosis, and that diagnosis will also, you might be guessing that this is what the disease is. And then your responsibility is to make sure that you confirm before you start treating. And that's why you send the patient to a laboratory for laboratory investigation, either blood, urine, or whatever, or x-rays, depending on the presenting complaints. And when you gather all that information, you will now come to a conclusive diagnosis. And then that's when you either make a prescription for the patient to go to the pharmacy to get the prescription filled, or you feel that this patient has to be admitted to be hospitalized, or the patient has to be operated on if it's a surgical problem. So these are the key functions of the doctor. See the patient, make a correct diagnosis, prescribe, and then also if it is a surgical or whatever procedure, you make sure that is done. And then follow up, of course. The importance of follow-up cannot be overemphasized, because the work of the doctor does not end by just giving out a prescription. I always tell my colleagues the work of the doctor actually ends when you see that that patient is up and about, health and healthy.
Now, is it possible, is there any possibility that when a patient comes to a doctor, after stating the symptoms the patient is experiencing, is it possible for a doctor to give that patient a prescription before referring that person for a medical test and checkup? Or
yeah, there are some, let me say, for example, if a patient has come, a known hypertensive, the patient has been seen by this doctor before, and the patient has just come for checkup, and you ask, do you have any problems? No problems. I've just come to fill my prescription. I don't have any symptoms. I don't have it. My drugs are finished. I just want you to check my blood pressure, make sure it's fine, and refill. In that case, the doctor can just, after seeing the patient, refill. In some cases, even at that, the doctor might feel, I have not checked this patient's urea and electrolyte over a 1 year period. Because once somebody is hypertensive, you must be looking at the heart, you must be looking at the kidneys from time to time. So in that instance, the doctor needs to write a laboratory investigation request. So it depends on what the patient comes for. Occasionally too, it might be a limitation of the practice. Take for instance, if the doctor is in a primary healthcare center, in a remote center, and all they have is a chair, the prescription table, and the prescription pad, and the pharmacy. No investigations. So, and that's where the clinical acumen of the doctor has to come into play. You have to guess and guess right, because you don't have any other way to confirm or guess that this is what the patient is. In that case, you're forced to make a prescription. It will be what we call therapeutic trial. You say, if it's malaria, okay, I give him, if the fever continues, he will come back. And then you probably look at other things and change the prescription.
So it's not against the medical
No, it's not.
practice.
Certainly not. Certainly not. But in some cases, there are certain symptoms a patient will come with, and if you don't do further investigations, you might be sued for medical malpractice.
It depends. Limited. It depends on the type of
case. Yeah.
Thank you very much. So, Ma, I would like you to state your primary duties as a pharmacist. What are your primary duties?
It's a bit difficult to give you a one-sentence answer, because the pharmacist does a lot depending on where the pharmacist practices. For instance, if you practice in the hospital, in the community, as an academic, or in the industry. So because for the sake of this program, probably I'll just narrow it down to hospital and community. I work in a hospital, so maybe I'm a bit biased towards hospital pharmacists. But like he said, the doctor writes a prescription.
Okay.
That's where the work of the pharmacist starts. So usually you check the prescription. Okay, is this prescription for patient A that is in front of me, or was it supposed to be for person B? Just to make sure all those things are correct. The right patient, the right age, the right weight. So that's the things the pharmacist will check. Then prepare the medication. So it's not just, oh, take this one 2-3 times a day. You call the patient in, sit down, counsel, speak to the patient, communicate with the patient the importance of taking this medication. Apart from dispensing, which is just 2 or 3 times a day medication, you also would make sure that drugs are constantly available. Because if you have prescriptions coming and there's no drug in the pharmacy, you know, that's another thing. Then you also do admin work. So everything that you do in the pharmacy should be documented. Like you said, there are cases of litigation. The only way you can get yourself out of trouble is if you actually have something to document. Like, let me give you an example. There was a time we were in the hospital and, you know, a patient came back with a lawsuit that, oh, he bought this cream here and the cream has expired. Okay, where is your receipt? Nothing. We checked through all our sales for that day and there was no record. So he was just being mischievous. So assuming we were not keeping records, we were just churning out the drugs as they come. You know, those are one of the things a pharmacist does. Apart from that, he also educates. So there are times whereby, oh, the doctors might be at a crossroad. They need information about drugs. The pharmacist is the best person to go and meet. Sometimes you have younger ones, like you said, you have the pharmacy assistants, the pharmacy technicians. You also educate them so that when they go to the community, they will not cause more havoc than is already there.
Okay, now I want to know, for a sick person, who would a sick person hold responsible? Like, after doctor's prescription, the pharmacy gives the drugs, and the person is not getting better. The sickness is still there. Who do you hold responsible? Whose fault is it? Is it the doctor's prescription, or is it that the drugs of the pharmacy gave to the patient is wrong? I just want you to enlighten us.
Okay, well, let's assume everyone did what they ought to do. Usually the doctor has seen the patient, he has, you know, asked for laboratory investigations, they have come, he has, based on that, made a diagnosis, prescribed medication. The patient has gone to the pharmacy, he has gotten the right medication. If the patient is not getting better, then he needs to go back to the doctor. He mentioned follow-up.
Yes.
There's sometimes that the patient did not tell us everything. Yes. You know, it's when we begin to probe. Or sometimes it might have even gotten worse. Like sometimes patients come in when it's too late. Maybe they have been, you know, taking one thing or the other at home. When the thing now overwhelms them before they come to the hospital and give us half information. And it's the information the patient gives you that you can work with. Like I said earlier, documentation. Okay. Everything we do, we document. So if anybody is even coming to look through what you're doing, you know, there's evidence.
Okay, just briefly, I want to know, from what you have been saying, it seems patients confide more in doctors than pharmacists. Why is that so? Do you have any idea?
I would disagree with that. Because usually in a standard Nigerian hospital setting, there is a lot of pressure on doctors. A lot. In fact, sometimes before the patient, like when patients come to the pharmacy, this is not an indictment on the doctors, but sometimes when the patient comes to the pharmacy, they'll say, before I even finish telling the doctor all what was wrong with me, he has already written me a prescription. Okay. And sometimes, let me play devil's advocate as well, you almost cannot blame them because the crowd is just overwhelming. You understand? And everybody wants to be seen. Yes. But sometimes when they come to the pharmacy, you can't just give them. There's no way you ask questions. So they might be able to tell you a bit more, you know, about what is wrong with them, about their other drugs, because sometimes patients even take herbal medication. They take other things that they cannot own up to the doctor, probably because they think, the doctor will just think I'm one, you know, herbalist or something, but they might be able to confide in the pharmacist. That's why that teamwork comes in, so that if they tell me something that I feel is important, and I think the doctor should know, definitely, I will tell the doctor.
Okay, thank you very much, Ma, for your contribution. Thank you for that. So, Doctor, what's your final take on this topic? What's your conclusion? What do you have to say?
Well, in fact, the whole essence of this program is who takes responsibility for the patient.
Yes.
My final listing is that the doctor is the head of the team in a hospital.
Okay.
So he will take the responsibility, except when it is obvious that people along the line didn't do their work. I'll give you an example. I'm a sexual assault expert for the British Council and the EU. I've been doing forensic medical examination training for doctors and nurses. I think I've done for about 17 states as we speak. Now, if you look at the scenario, what are we doing? We're teaching the doctors how to, first of all, get a consent from the patient before you examine. These are legal related issues, medical legal issues. Because you remember that once you show up in court, the defense counsel and then also defense experts are your adversaries in court. And they will be looking at those fine details. First of all, who has given you the responsibility? Is there a law on earth that says you are to see this patient, clerk the patient, and see the patient? If it's not written clearly that you are the person responsible, it is any evidence you give in that court is like straws in the wind. So it's also very important to know that the responsibility of a patient or of the doctor is paramount in a hospital or in a clinic setting. But if the patient shows up in a pharmacy and then he or she is seen by the pharmacy, then the pharmacy is culpable. And it's even much more, that's why I always say, that's why some of us push that. There's a lot of patients that are being seen in pharmacy outlets, especially the pattern medicine outlets, not even proper designated pharmacies where you have pharmacists. At least there's something I say, where the eagles dare, Nigerians will go and perch. So where a pharmacist will see a patient and say, no, this is too much for me, let me refer. The pattern medicine store will now assume the role of a doctor and start doing. And a lot of deaths have been occurring at that level. And that's why some of us felt that this should be regulated. And that's why there's a training now going on for the PPMVs. And then there's a hub and spoke this arrangement where the pharmacist is where they have to come to, and then give the pharmacy responsibility to supervise. But for issues of injection, we're saying that a doctor should have to also to be included in that distance so that we can take care of adverse effects that will come. So this is the way I look at it.
Okay.
Thank you.
Thank you very much, sir. So, Ma, briefly, what's your final take on this topic?
Well, on prescriptions, I still believe we all work as a team. And the most important thing is the welfare and the clinical outcome of the patient. So basically from a human, economic, and clinical point of view, as long as that is met, then we are all fine.
Okay. So viewers, you heard from the doctor, the responsibility of the patient as a doctor. We want to thank you both for coming, for taking your time to enlighten the viewers on this very topic. Thank you, Ma, for coming. Thank you, sir. Thank you very much.
Thank you very much.
Pharmacists are healthcare professionals who practice in pharmacy, supervise the medicine supply chain, and ensure pharmacy premises and systems are fit for purpose. Doctors are specially trained and licensed medical professionals, and their job is to make diagnosis and then treat you so that you can get better. Therefore, prescribed medicine that you get from your doctor and pharmacy are always safe. In other words, they are allowed to prescribe and supply prescripted drugs. They will also tell you how you should use the medicine. Hence, your doctor and pharmacist are your point contact for advice on medical matters. So always take medicine exactly as prescribed and always follow your doctor's or pharmacist's instructions. Viewers, this is where we draw the curtain for this week's edition on Crossfire. We promise to bring you more exciting and interesting topic when next we come your way. Until then, always stay healthy and don't take overdose. Bye and God bless you.